There's a lot of changes as we age, including our brain health, cognitive decline, often associated with the elderly population. People of any age can experience a difference in their brain function. Taylor Castro spoke with a physician about how we can take care of our brains. And Taylor, when it comes to aging, it's a common belief that family history is a big risk factor.
Yeah, Tom, genetics are involved, but your sleeping and eating habits also play a role. Plus, recent research shows that keeping up with your social environment and interactions can delay the onset of cognitive decline.
We hear a lot about concerns where there's family history and, genetics involved, and we're learning more and more that it has really a lot to do with kind of your inherited lifestyle versus your inherited genes.
Social interaction can be uplifting to the brain and mood, which is still essential as we age. Signs of cognitive decline and injuries to the brain aren't always something you can identify by yourself.
The others around you, your family members, your teachers, your peers, might notice that you might be a little slower to comprehend or to move. Those can be very telltale signs or subtle signs that there may be some type of brain injury or insult that may have occurred.
Some of the most common signs are generalized fatigue, headaches, dizziness, and blurred vision. Those can be a result of a direct trauma. Sometimes even medications can create a state of confusion or slow the brain down. Doctors say it's not only important to get enough sleep, but to make sure it is quality sleep.
We really need the younger folks to be really conscious about making sure they're getting adequate rest and a good amount of sleep to rest that brain, and adequate hydration, making sure you're keeping up with your fluid intake.
Society can put a lot of people in denial about cognitive impairment or decline. Physicians encourage open conversations with your loved ones and providers.
Do not delay an assessment of cognitive function due to fear, because the earlier we tend to identify what we like to call mild cognitive impairment, which can sometimes be a normal part of aging, if identified early, can be interrupted or slowed down to not create an impact on one's vitality in life.
An evaluation may find that the cause of someone's cognitive impairment is reversible. That can include vitamin deficiencies, underlying sleep apnea or hypertension, or other conditions that, with further refinement, can solve the issue. Tom?